here today with Dr. Radcliff. And Dr. Radcliff, thank you for having me today. And I'm so glad that you take the second to actually speak to me, to everyone, about high blood pressure. Can you tell us, what is high blood pressure?
Well, it's a silent killer. So many of us do not know we have it. And what's important to understand is what is blood pressure in general. And that's the force against our artery walls that's generated by the heart, which is the pump, as well as the resistance. And what I like to say to patients is to think about a garden hose. There's a force generated and then there's an intrinsic resistance. And if over time that pressure gets too high, the hose itself will get damaged. And also the plants, if you're forcing too much water pressure on them, they'll get damaged as well. And we want to think of the plants like our organs, our heart, our kidneys, our eyes. If the pressure is too high, they can get damaged.
Wow. You know, that's a great way to really explain, because it gives us more in depth or exactly what is happening in our body. Because we hear so many times high blood pressure, hypertension, all of these different terminology, but we really don't know.
Correct.
But what advice can you give someone, the steps that we can take to actually reduce our high blood pressure or actually maintain a healthy lifestyle?
Well, first of all, you want to know that you have high blood pressure. Many people have no idea because they don't check their blood pressure.
Mm-hmm.
So we need to check it. When you see your doctor, you should check it. So anyone over the age of 18 years old should check it at least every 2 years. And one easy way is when you go to the doctor's office, get it checked there. If you're at the drugstore, any drugstore usually has an automatic blood pressure reading machine, and you should get it checked so you have an idea. And you should check it in both arms, not just one. You should check it when you're sitting down, check it in one arm, and then check it in the other. And hypertension is not diagnosed based upon one reading. It's over several readings. So if you go to your doctor's office and it's a little bit high, not to be worried. There's a syndrome called white coat syndrome where just anytime when you're around a physician or a healthcare facility, there's some anxiety and it elevates your blood pressure. So a doctor would not make the diagnosis based upon one reading. It would be 2-3 readings, either in the course of a doctor's visit or a repeat course. When you come back, your doctor may ask you to check it at home as well.
Is there any symptoms that someone can have that will give you a little clue that you do have high blood pressure?
And that's a scary part. This can be silent for years, and you might not know any symptoms until the damage has been done. And so it's important to check it ahead of time. If in some cases you have headaches that are not going away, if you're having chest pain, that might be a symbol. If you're having swelling in your feet, but again, those are usually after the damage has been done. Don't let this get so bad that we don't find out when there's nothing you can do or when you have kidney failure.
Okay, and this is why I am really urging everyone.
Right.
February is hot month.
Absolutely.
Take the blood pressure challenge, and because there's so many people out there who have not been in doctors in several years,
Right.
and they need to take that
Right,
step.
and all you have to do, everyone goes to the drugstores, just get checked there, and that's why I'm so glad you're doing this. This is great. You might be saving somebody's life.
Thank you. Thank you, Dr. Radcliff. February is not only the love month, but it's also the heart month. I urge each one of you to take the blood pressure challenge. High blood pressure can lead to stroke and heart disease. Please do not take the chance in not knowing your number. Save yourself, save someone's life, tag someone, and urge them. Take the challenge, know your number. Please go to goredforwomen.org and make a donation. Thank you.